My checkoff for Radial Pulse. First, you are going to get your patient, use the anterior part of their wrist on the thumb side, and you can just that's fine. Okay, you're gonna try not to use your thumb because it technically has a stronger pulse than the rest of your fingers. You're gonna find the artery. You can either count for 30 seconds and multiply it by 2, or do the full minute, and obviously you don't have to multiply it. So when you're assessing your pulse, you're gonna count for the rate. So normal is usually like 60 to 80 beats per minute. Tachycardia is anything over 100, and bradycardia is anything under 60. Bradycardia could be from like meds or just training, so athletes are a lot lower than normal people, or tachycardia could be from like shock or like overexertion, so just getting done with a workout. You're going to assess the rhythm, so if it's regular, it's going to be either rapid or slow, depending on the training of the person that you're assessing, or irregular, which is unsteady or uneven. You're also going to look for the strength, so if it's bounding, it's going to be strong. Usually people use the word weak for like a difficult to detect pulse, or absent for no pulse detected whatsoever. So some combinations would be like weak and strong would represent like exertion or shock. Rapid and weak would be like bleeding or shock. Absent would be cardiac arrest or dead. And slow and strong could also be like late stages of shock or like brain trauma or something like that. It's important to check for people's pulse to make sure they are alive. Some different factors that can affect one's pulse would be like age, gender, medications, trauma, exercise, temperature, stuff like that.